If you are a man over the age of 50, there is something happening inside your body that almost no one talks about. It is not discussed among friends. It is not explained clearly in medical appointments. It is not mentioned in daily news or health programs. Yet this silent change affects millions of men across the United States, the United Kingdom, Germany, Italy, France, Canada, Sweden, Ireland, and every other country where men are living longer lives. It influences prostate health, hormone balance, sleep quality, mental clarity, and even long-term physical strength. And it is connected to one of the most misunderstood topics in men's health. The truth is simple but surprising. If you're older and you rarely or never ejaculate, your body begins to experience changes that you may not recognize at first. These changes are not about desire or intimacy. They are about biology. They are about the prostate. They are about circulation. They are about fluid buildup. They are about male hormones that shift dramatically after 50. Most men do not know this. They assume everything is normal. They assume aging is the only explanation for their discomfort, their heaviness, their pressure, or their reduced energy. But urologists around the world have been warning men for years that ignoring this natural process can slowly create problems that could have been prevented. Let me begin with a story that reflects the experience of many men today. In Ohio, a 68-year-old man named Robert started feeling dull pressure in his lower pelvis. It was not painful, it was simply uncomfortable. He felt it when he sat in his recliner. He felt it when he drove his car. He felt it when he slept on his side. His doctor tested his prostate, ran his blood work, and told him something unexpected. The doctor said his prostate was congested. It was not inflamed from infection. It was not enlarged from cancer. It was swollen because he was not releasing fluid regularly. His prostate had accumulated fluid, creating pressure that slowly built up over time. The doctor told him, "Your body was designed to release. When it does not happen, your prostate begins to send signals." A similar story happened in the United Kingdom. A 71-year-old retired engineer named Dole experienced nighttime discomfort. He felt heaviness around his bladder. He felt incomplete emptying. He struggled with restless sleep. His doctor explained that his prostate was full and congested. The doctor said that many older men experience this because they reduce sexual activity as they age, but the prostate continues producing fluid. Without regular release, the gland slowly becomes swollen and irritated. Michael had never heard this before. No one had told him that ejaculation frequency could influence prostate comfort. These stories are not rare. In fact, they are extremely common. Urologists in Europe and North America explain that the prostate is an active gland throughout a man's entire life. It continues to produce fluid regardless of age, desire, or activity level. Even if a man is not sexually active, the gland keeps working. But when fluid stays inside the prostate for too long, pressure builds, cells become irritated. Circulation slows, inflammation increases, and this can create symptoms that men mistakenly blame on aging. Here is where the story becomes even more important. For years, researchers have studied the relationship between ejaculation frequency and prostate health. Several studies, including a well-known one from Harvard University, found that men who release more often have better long-term prostate outcomes than the men who rarely do. The reason is not about sex, it is about fluid turnover. It is about reducing stagnation. It is about keeping the prostate clean, healthy, and able to function normally. When the prostate is active, it stays healthier. When it remains stagnant, it becomes stressed. But sadly, many men were never educated about this. They were never told that healthy ejaculation is part of prostate hygiene. They were never told that the prostate needs release the same way the stomach needs digestion and the bladder needs emptying. So as they grow older, many men unknowingly create internal pressure that slowly affects their comfort and their confidence. In this video, we will explore the hidden truth that every man over 50 must understand. We will discuss the biological role of ejaculation in prostate function, why the prostate continues to produce fluid even when a man stops being sexually active, how delayed release leads to swelling and stagnation, and what urologists recommend older men do to maintain healthy circulation and glandular function. We will explore the myths, the science, and the misunderstood details that many men never learn until it is too late. Your body is not working against you. It is simply following a natural design. Once you understand how the prostate works, you can support it, protect it, and keep it functioning comfortably in your 60s, 70s, and even your 80s. As men grow older, they slowly adjust to changes in their daily life. They move a little slower in the morning. They drink less coffee because it affects their stomach. They become more careful about their sleep. They stretch a bit before walking. They take medications more regularly. They also experience natural changes in intimacy, desire, and physical function. But one change that very few older men understand clearly is the decrease in ejaculation frequency. It feels harmless. It feels normal. It feels like a natural part of aging. But inside the body, something very different is happening. The prostate does not follow retirement. It does not slow down because desire slows down. It does not stop its activity because you stop your activity. The prostate continues working every single day, producing fluid, storing fluid, and preparing fluid that is essential for one simple biological purpose. When this fluid stays inside the gland for too long, it causes congestion. This congestion is not dramatic at first. It begins quietly. It begins slowly. It begins with subtle changes that most men ignore: a mild feeling of fullness, a slight pressure behind the scrotum, a faint heaviness when sitting, a little discomfort when crossing the legs, a sense of dragging in the lower pelvis. Men notice these things, but they push them aside. They assume this is what getting older feels like. But what they are feeling is the early stage of prostate fluid buildup. To understand this clearly, imagine the prostate like a small sponge that continually produces fluid. When you are younger, that sponge is emptied regularly. The flow is constant, the drainage is natural. But after 50 or 60, when the frequency of release decreases, the sponge begins absorbing and holding more and more fluid. Over time, the tissue expands, the pressure increases, the gland swells slightly, blood flow becomes restricted. Small ducts inside the gland begin to narrow. This is what urologists call prostate congestion. Prostate congestion is one of the most misunderstood conditions in older men. It is not an infection. It is not cancer. It is not something you will see in a scan immediately. It is a functional problem caused by stagnation. It often shows up as discomfort rather than pain. It feels like heaviness rather than sharp sensation. It feels like slow pressure building rather than sudden injury. And because the symptoms are vague, men do not talk about it. They do not ask questions. They do not connect the dots. They simply accept it as part of life. Let us explore a story from the United States that shows how easily this problem is overlooked. In Arizona, a 62-year-old man named Harold began experiencing difficulty sitting for long periods. He loved reading newspapers every morning, but he found himself shifting in his chair often. He blamed the cushion on the sofa, then he blamed the way he sat. Then he blamed his age. Finally, after months of discomfort, he went to a urologist. The doctor asked him about his release frequency. Harold felt embarrassed and said it had been a long time. The doctor smiled and explained that his prostate was not emptying naturally, causing swelling. The doctor said, "Your body is trying to tell you something." A similar situation happened in Germany. A 70-year-old man named Dieter experienced frequent nighttime urination. He assumed it was only his bladder. He assumed it was normal aging. But during a urology exam in Munich, his specialist explained that his prostate was congested. It was pushing against the bladder and irritating the nerves that trigger the urge to urinate. Once Dieter addressed this underlying issue, his nighttime urination decreased. Stories like these show how lack of understanding creates unnecessary suffering. Men believe they are dealing with bladder problems, back problems, digestion problems, or simple aging. But often, it is the prostate quietly sending signals. Another important factor is hormonal change. After the age of 50, testosterone levels decrease gradually. This slows down reproductive function and reduces natural desire. But it does not stop the prostate from producing fluid. The production continues whether a man feels desire or not. This mismatch between desire and fluid production is one reason older men experience more congestion. A study from a European urology journal found that older men who ejaculate less than once a week have a significantly higher likelihood of prostate discomfort compared to men who release more regularly. The study emphasized that release is not about sexual activity. It is about glandular health. It is about reducing stagnation inside the prostate. It is about preventing pressure from building. Now let us explore another hidden consequence of lack of ejaculation: circulation. The prostate is surrounded by a complex network of blood vessels. Healthy blood flow is essential for removing waste products and delivering oxygen. When the prostate becomes congested, circulation slows. Poor circulation increases inflammation. The tissues become more sensitive. The nerves become irritated. This is why many older men feel vague aching or dull pressure in the lower pelvis when they sit for a long time. In Sweden, a 68-year-old man named Lars experienced this exact problem. He described it as a tired feeling in the pelvis. His urologist told him the prostate tissue was swollen and congested, preventing proper circulation. Once he began addressing the congestion, the tired sensation gradually faded. Another consequence is reduced drainage of tiny ducts inside the prostate. The prostate contains small channels that carry fluid into the urethra during ejaculation. When they are not used for long periods, some become sticky, some become partially blocked. Some develop microscopic inflammation. This can create burning sensations, intermittent discomfort, or a feeling of pressure in the perineum. This is why many older men describe discomfort when sitting on hard surfaces. They think the chair is the problem, but the problem is inside the gland. A urologist in Italy explained this perfectly to one of his patients. The prostate is designed for activity. When there is no activity, it complains quietly. Let us also understand how lack of ejaculation affects the bladder. When the prostate becomes congested and slightly swollen, it presses against the urethra. It restricts the flow of urine. It makes the bladder work harder. Over time, this can lead to incomplete emptying or the frequent urge to urinate. Men assume they have developed an overactive bladder, but in many cases, the root cause is a prostate that has not released fluid for long periods. This effect is even more noticeable in men with an already enlarged prostate. Benign prostatic hyperplasia, also known as BPH, is extremely common in older men. When congestion is added on top of enlargement, symptoms worsen quickly. The pathway narrows. The bladder strains. Men feel frustrated and confused. In the United Kingdom, a man named James experienced this problem. He had mild BPH but managed it well for years. After reducing ejaculation due to health challenges, he began feeling strong urgency and weak flow. His specialist explained that prostate fullness made his BPH symptoms worse. Once the congestion was reduced, his symptoms returned to normal. It is also important to note the connection between ejaculation frequency and long-term prostate health. Several large studies, including research published by Harvard, found that men who ejaculate more often have better prostate outcomes over time. The reason is simple. The prostate removes old fluid and cellular waste during ejaculation. This process may help reduce the accumulation of substances that are harmful to the tissue. When this natural cleansing does not occur, the gland remains full of old fluid that should have been released. Think of it like cleaning a filter. A filter that is never cleaned becomes clogged, stagnant, and inefficient. The prostate acts in a similar way. Regular release helps maintain its function. Lack of release allows congestion to build until a man feels discomfort. Now let us talk about inflammation. Many older men experience chronic low-grade inflammation without knowing it. This can occur inside the prostate when fluid builds up and circulation slows. This inflammation is not severe enough to cause intense pain, but it is enough to produce discomfort, swelling, heaviness, and pressure that becomes worse over time. Men in their 60s and 70s often describe pelvic discomfort as just a nuisance. They rarely consider that it may be related to lack of ejaculation. But when urologists explain the biological mechanism, men finally understand. Another critical factor is stress. As men age, stress can increase due to family responsibilities, medical concerns, financial changes, or life transitions. Stress affects hormonal balance. Stress also increases tension in the pelvic floor muscles. When ejaculation is rare, these muscles remain tight, adding to prostate pressure. The combination of a congested prostate and a tense pelvic floor increases discomfort significantly. Several urologists from Europe report that many older men who experience pelvic pressure also have tight pelvic floor muscles. Once they release fluid regularly and relax the pelvic area, their discomfort improves dramatically. Let us now explore the emotional and mental side. Many older men feel embarrassed discussing ejaculation, even with doctors. They fear judgment, they fear misunderstanding, they fear awkward silence. This leads men to hide symptoms that could have been resolved easily. Many older men live with discomfort for years before seeking help. In Canada, a 74-year-old man named Philip did not talk about his symptoms with anyone. He only mentioned urinary frequency to his doctor. But when the doctor asked deeper questions, Philip admitted he had not ejaculated in several years. The doctor explained that his symptoms were directly connected. Philip felt relief and frustration at the same time. Relief because the cause was simple. Frustration because no one had explained this earlier. Another major issue is misinformation. Older men sometimes believe myths that fear too much release or think it weakens the body. But medical research shows the opposite. Regular release is healthy for the prostate. It reduces stagnation, it reduces congestion, it reduces the risk of inflammation. One of the biggest myths is that older men should stop all sexual activity. This belief causes many men to suppress natural processes that their body needs. Urologists consistently emphasize that ejaculation is not only about desire, it is about biological function. It is about keeping the prostate active, drained, and healthy. Now let us discuss how this affects sleep. Many older men experience nighttime discomfort due to prostate congestion. They wake up from pressure, they turn from side to side, they go to the bathroom multiple times. They struggle to fall back asleep. They think the issue is only the bladder, but it is also the prostate pressing against the bladder base. Once the congestion is relieved, the nighttime symptoms often improve. In Ireland, a 66-year-old man named Sean experienced this problem. He woke up 3 or 4 times every night. He felt pressure, but very little urine would come out. After addressing prostate congestion, he returned to 1 bathroom trip per night. His sleep improved, his energy improved, his mood improved. The change was almost life-changing. Let us also mention the role of immune function. A congested prostate becomes more vulnerable to irritation and infection. When fluid stays inside the gland for too long, bacteria from the urethra can enter and multiply. This can cause prostatitis, which is painful and difficult to treat. Urologists often explain that regular release helps clear the ducts and reduce the risk of bacterial buildup. Another consequence of congestion is reduced confidence. Many men feel uncomfortable, heavy, or swollen in the pelvis. This affects how they sit, how they walk, how they interact socially, and how they feel about themselves. But because the issue is rarely discussed publicly, men feel alone. They blame themselves. They assume something is wrong with them, but the truth is simple. Their prostate is asking for attention. Now let us move toward a deeper biological truth. Ejaculation is one of the only natural ways the male body clears the prostate. There is no other built-in system for draining it. There is no natural substitute. When a man is young, this happens frequently without much thought. But after 50 or 60, when the frequency decreases, the drainage decreases as well. If the gland cannot drain itself, it accumulates more fluid. This is the core reason older men feel pressure. Lastly, let us address the misunderstanding that older men should simply endure this discomfort. No man should live with unnecessary pelvic pressure. No man should assume that silence is strength. No man should ignore a gland that influences his bladder, his hormones, his comfort, and his long-term health. Your body is sending signals for a reason. Once you understand the cause, you can support your prostate with clarity and confidence. Inside the male body, the prostate is one of the most active glands from adulthood until the final years of life. Yet most men misunderstand it. They think the prostate is only involved in intimacy. They believe it is a gland that becomes important only during sexual moments. But medically, the prostate is much more than that. It is a living, constantly working organ that continues producing fluid even when a man's desire slows down. It behaves the same whether a man is 20 or 80. It continues producing and storing fluid because that is what it is programmed to do. When that fluid is not released on a regular basis, the internal environment of the prostate begins to change in ways many men never learn about until symptoms appear. The first hidden truth is that the prostate does not shut off production. Many men assume that with age, the gland slows down. In reality, the opposite often happens. The prostate becomes more active as testosterone converts into a hormone called dihydrotestosterone. This hormone increases the activity of the prostate cells. Even when a man does not feel desire, those cells continue working. Throughout the day and night, the prostate produces small amounts of fluid, and that fluid fills small ducts inside the gland. If these ducts are not emptied, they become swollen. This swelling is not dramatic at first. It is soft, subtle, and almost silent. But it is enough to change the way a man feels in his pelvis. The second hidden truth is that prostate fluid does not disappear on its own. The body cannot absorb this fluid back into the bloodstream efficiently. The gland is designed to release it outward, not inward. So when release does not happen, the fluid stays inside the ducts. Over time, the ducts stretch, they widen, they become irritated. Pressure builds inside them. This pressure is one of the main reasons older men feel heaviness, dull aching, or a sense of fullness in the lower pelvis. It is not something men imagine. It is a biological response to trapped fluid. A urologist in Boston once explained it clearly to a patient. Your prostate is like a sponge. It fills with fluid. If it is not squeezed, it stays full. A full sponge becomes heavy and uncomfortable. A full prostate behaves the same way. The third hidden truth is that prostate congestion interferes with blood flow. The prostate sits near major blood vessels. When the gland becomes swollen with trapped fluid, it presses on surrounding tissues. It reduces circulation. This creates a warm, tight, inflamed environment that becomes worse with time. Reduced blood flow also affects nerve function. Nerves in the pelvis become more sensitive. Men begin to feel vague, dull sensations that they cannot describe. They know something feels different but cannot name the cause. In Denmark, a 66-year-old man named Casper told his urologist he felt a balloon inside the pelvis. He thought it was his bladder. He thought he needed more fiber. He thought it was simply age. But scans revealed his prostate was congested with fluid. Once this was resolved, the balloon feeling disappeared. The problem was not digestion. It was the prostate storing what the body expected to release. The fourth hidden truth involves inflammation. When prostate fluid stays inside the gland, it becomes thicker over time. Just like any fluid that remains in a confined space, it loses freshness. The cells lining the ducts become irritated by the older fluid. This irritation triggers low-grade inflammation. This inflammation is not enough to cause unbearable pain, but it is enough to create persistent discomfort. It is enough to cause burning sensations when sitting. It is enough to create pressure when walking. It is enough to trigger swelling that presses on the bladder. In Italy, a 72-year-old man named Enzo experienced this. He felt mild burning for more than a year. Antibiotics made no difference. Painkillers did nothing. When the urologist explained that inflammation was caused by old fluid trapped inside the prostate, Enzo was shocked. No one had ever told him that ejaculation could influence inflammation inside the gland. The fifth hidden truth is that prostate congestion affects the bladder. As the prostate becomes fuller, it begins to intrude into the urinary canal. This narrows the pathway. The bladder must use more effort to push urine through the narrowed space. This causes nighttime urination, weaker flow, dribbling, and frequent urges. Many men believe this is simply aging. But often the problem is congestion, not structural enlargement alone. When the prostate empties more frequently, many urinary symptoms improve, even without medication. In Ireland, a 71-year-old man named Patrick experienced this. He woke up 3 or 4 times every night. He thought it was his bladder weakening. His urologist explained that a congested prostate can irritate the bladder's base and trigger unnecessary urgency. Once Patrick addressed this issue, he returned to one bathroom trip per night. His bladder was never the problem. His prostate was overloaded and sending false signals. The sixth hidden truth is psychological. Many older men feel embarrassed to discuss ejaculation. They believe it is inappropriate to talk about at their age. They believe doctors will judge them. They believe they should simply accept the changes in their body. This silence prevents men from understanding what is happening inside them. It prevents them from learning that prostate health is not about intimacy, it is about function. It is about circulation, it is about comfort. It is about preventing stagnation that leads to discomfort and inflammation. Urologists around the world emphasize that ejaculation is part of male biology, similar to the way bowel movements or bladder emptying are essential. When this natural function stops completely, the gland suffers, the ducts suffer, the tissues suffer. Silence is the enemy of prostate health. The seventh hidden truth is that prostate congestion can mimic more serious conditions. A congested prostate can create symptoms similar to prostatitis, similar to the early stages of BPH, and even similar to urinary tract issues. Men often panic. They worry, they fear the worst. But many times, the root cause is simply stagnation. A urologist in London once said, "Men fear cancer when the body is simply asking for release." The eighth hidden truth concerns bacterial balance. When fluid stays inside the prostate for long periods, bacteria can multiply more easily. This does not always cause infection, but it increases irritation. The ducts become more sensitive. The surrounding tissue inflames easily. This is one reason some men develop chronic prostatitis even without infection. Trapped fluid becomes a fertile environment for irritation. Another important truth is that ejaculation is not purely about pleasure. It is a biological maintenance process. Men who are not sexually active can still ejaculate naturally or manually. This has nothing to do with intimacy. It is a health practice that supports the prostate's natural function. It is urologically recommended for men experiencing congestion. The ninth hidden truth is that ejaculation affects hormone clearance. When men ejaculate, certain prostate hormones and enzymes are released that otherwise remain inside the gland. These substances build up if not cleared. This buildup contributes to swelling, irritation, and discomfort. Several urologists in Europe emphasize that prostate drainage helps rebalance the internal chemical environment of the gland. The 10th hidden truth is that many men mistake pelvic floor tightness for prostate problems. In reality, both issues are connected. When the prostate becomes congested, the pelvic floor muscles tighten to compensate. This creates a cycle. A swollen prostate increases muscle tension. Muscle tension increases discomfort. Discomfort increases swelling. And the cycle continues until the prostate receives the relief it needs. A man in California once told his urologist that his pelvis felt locked. The doctor explained that the prostate, nerves, and pelvic muscles communicate constantly. When one is affected, all respond. Regular release breaks this cycle. Finally, the most important hidden truth is this: the male body was never designed for long-term prostate stagnation. It is biologically normal for the prostate to empty. When it does not empty for long periods, the gland becomes congested, swollen, irritated, and sluggish. The symptoms may be quiet, but they are real. Your body is not malfunctioning. It is sending a message that many men ignore because they never learned the true function of the prostate. Understanding these hidden truths gives men over 50 the power to protect their prostate, support comfort, and prevent years of unnecessary discomfort. Once men understand what is happening inside the prostate when ejaculation becomes rare, the next question arrives naturally and urgently. What should a man over 50 do to keep his prostate comfortable, healthy, and functioning properly? This is where urologists around the world share a simple but powerful truth. The prostate must empty. It must release the fluid it produces. It must clear its ducts. It must maintain circulation. It must remain active enough to prevent stagnation. This is not about sexuality. It is not about performance. It is not about desire. It is about biological maintenance and prostate hygiene. The first part of the solution is understanding that ejaculation is a normal, healthy function for older men. Many men believe that intimacy slows with age, so ejaculation no longer matters. But urologists emphasize that ejaculation plays a completely separate role. It is a cleaning mechanism. It is a pressure release mechanism. It is a circulation support mechanism. It is a way to prevent fluid stagnation. It is a way to protect the gland from congestion and irritation. Just as the bladder needs to empty regularly, the prostate also needs to empty regularly. Older men must remove emotional or cultural hesitation around this topic. They must understand that prostate drainage is not tied to youth. It is not inappropriate at older ages. It is not shameful. It is simply a normal biological act that supports health. Urologists repeatedly remind men that ignoring this function does not stop the prostate from working. The prostate continues producing fluid whether a man allows release or not. When release does not occur, the gland suffers. This is why many urologists recommend that older men maintain a reasonable ejaculation frequency, even if intimacy is no longer part of their life. For some men, the recommendation is once a week. For others, every 10 days. For others, twice a week. The exact number varies depending on individual health, medical history, comfort, and hormonal changes. The point is not frequency for pleasure. The point is gentle, consistent prostate drainage. The point is to keep the ducts open, keep the gland empty, and keep the tissue from swelling. Even a modest amount of regular release is enough to prevent fluid buildup. A urologist in New York explains it simply: if you do not empty the prostate, it fills itself. And a full prostate will always complain. Another specialist in Germany tells his patients, release is not an optional behavior. It is part of normal prostate hygiene. The second part of the solution is restoring circulation inside the pelvis. Congestion restricts blood flow. Without healthy circulation, inflammation rises quickly. Urologists often recommend gentle pelvic exercises, daily walking, and light stretching to increase blood flow to the gland. Activities such as walking, cycling with proper seat cushioning, and slow squats help encourage circulation. This increased blood flow helps clear old fluid, reduce swelling, and improve tissue Oxygenata in Sweden. A 68-year-old man named Henrik followed his urologist's advice. His doctor told him that movement is medicine for the pelvis and that stillness fuels congestion. Henrik added a daily 20-minute walk and a few pelvic stretches. Within 2 months, he noticed less pressure and more comfort, even before adjusting his ejaculation routine. The improved circulation alone made a difference. The third part of the solution is relaxing the pelvic floor. Older men often tighten their lower abdominal and pelvic muscles without realizing it. This tightness compresses the prostate and increases pressure inside the gland. When combined with congestion, the tension becomes even worse. Many urologists teach their patients to perform simple pelvic relaxation techniques. This does not require complicated exercises. It requires slow breathing, relaxing the lower abdomen, releasing tension in the hips, and avoiding the habit of clenching. Men who practice pelvic relaxation often report less pressure, less burning sensation, and better urinary flow. Releasing the pelvic floor is especially important for men with long-standing tension. A man in Italy experienced dramatic improvement after learning pelvic relaxation. He had been holding tension for years without knowing it. Once he learned to relax the muscles surrounding the gland, the pressure decreased significantly. His urologist told him, "Your prostate has been squeezed by your own muscles. Now it can breathe." The fourth part of the solution is hydration. Many older men drink too little water, often to avoid frequent urination. But dehydration thickens prostate fluid, making it more difficult for the gland to empty. Thicker fluid increases irritation. Proper hydration thins the fluid and makes release more efficient. Urologists often recommend steady, moderate hydration throughout the day, rather than drinking large amounts at once. The fifth part is reducing inflammation in the body. A congested prostate becomes much more uncomfortable when the body is inflamed. Diet, lifestyle, stress, and certain foods can increase inflammation. Many urologists recommend simple, realistic changes: more vegetables, more water, less sugar, less processed food, less alcohol, less heavy evening meals, These small adjustments reduce inflammation throughout the body, including the prostate. Many men notice that their prostate symptoms worsen during periods of stress or after large, unhealthy meals. When they adjust their lifestyle even slightly, pressure, heaviness, and discomfort decrease noticeably. The sixth part of the solution is avoiding prolonged sitting. Sitting for long periods compresses the prostate and reduces blood flow. Older men who spend hours on recliners, office chairs, or car seats often experience increased discomfort. Urologists suggest standing up every 30 to 40 minutes, stretching the hips, or using a cushion designed to reduce pressure on the perineum. These small habits protect the gland from unnecessary compression. The seventh part of the solution is addressing medical conditions that worsen congestion. Conditions such as BPH, tight pelvic muscles, chronic inflammation, or urinary tract issues can amplify prostate discomfort. Urologists can evaluate these conditions and provide treatments such as medication, supplements, pelvic therapy, or tailored advice. Addressing underlying issues enhances the effects of regular prostate emptying. The eighth part of the solution is listening to the body. Many older men ignore early warning signs. They suppress discomfort. They tell themselves not to worry, but the body always speaks. If pressure builds, if discomfort increases, if urination changes, if the pelvis feels heavy or irritated, these are early signals of congestion. Responding early prevents long-term issues. The ninth part of the solution is honesty. Men must be honest with themselves and their doctors. They must stop viewing ejaculation as something irrelevant after 50. They must accept that their prostate still needs attention. Urologists reassure men that this is not about youth or performance. It is about health. It is about maintaining normal male function. It is about preventing years of unnecessary discomfort. The 10th part of the solution is routine. Once a man commits to a consistent ejaculation schedule, improvements often appear within weeks. Men report reduced pelvic pressure, easier urination, better sleep, fewer nighttime bathroom trips, improved mood, and greater comfort when sitting. They feel lighter. They feel clearer. They feel balanced. A man in Ireland explained it perfectly after following his doctor's advice. I did not know how heavy I felt until I finally felt light again. His prostate had been congested for years. Regular emptying, movement, and relaxation changed everything. The 11th part of the solution is proactive awareness. Older men must understand that ejaculation frequency will affect them for the rest of their lives. Just as maintaining the bladder, bowel, heart, and lungs becomes more important with age, so does maintaining the prostate. The 12th part is respect for biology. The body does not follow emotions or beliefs. It follows natural laws. The prostate produces fluid. That fluid must leave the body. When it does not, the gland swells. When it swells, it complains. When it complains, men suffer. Respecting this truth prevents unnecessary suffering. Once men understand these solutions, they feel empowered rather than embarrassed. They realize they are not broken. They realize nothing is wrong with them. They realize their discomfort was not their fault. Their body was following its natural design, and they simply did not know how to support it. Knowledge is the cure for confusion. Understanding is the cure for fear. Action is the cure for discomfort. Your prostate belongs to you. Your comfort belongs to you. Your health belongs to you. As we reach the final part of this important discussion, it is time to bring everything together. If you are a man over 50, understanding your prostate is no longer optional. It is a requirement for comfort, strength, confidence, and long-term health. Your prostate has been quietly working inside you for your entire life. It has produced fluid every day since your youth. It has continued its activity even when desire slowed. It has followed its natural program even when your lifestyle changed. And when ejaculation became rare, the gland began experiencing the consequences of stagnation, pressure, and reduced circulation. Now that you understand the problem and the hidden truths behind it, the next step is learning the final part of this journey: what to avoid, how to protect yourself, and how to create a routine that keeps your prostate comfortable and healthy. For the rest of your life, let us begin with this fact. Your prostate does not need dramatic changes. It needs consistency. It needs simple habits. It needs respect. It needs understanding. Many men think they must become 20 years old again to support their prostate. But that is not true. Older men do not need youthful desire. They need healthy maintenance. They need realistic, comfortable routines. They need to work with their body, not against it. The first piece of final advice is simple. Listen to your body. If you feel pressure in the pelvis, do not ignore it. If you feel heaviness or fullness when sitting, pay attention. If your bladder urges become more frequent, do not assume it is only age. If your pelvis feels tight or tired, your prostate may be signaling that it is overloaded. Your body is always speaking. The problem is that many men have trained themselves to stay silent. They push discomfort aside. They tell themselves to toughen up. They pretend that everything is normal. But silence is not strength. Understanding is strength. Responding is strength. The second piece of advice is to avoid long periods without any form of prostate release. You do not need to force anything. You do not need intensity. You do not need to match the habits of your youth. But you do need regular, gentle release to maintain the gland's natural function. When ejaculation becomes part of a healthy routine, the prostate stays empty, the ducts stay clear, the circulation stays active, and the discomfort fades. Many older men report that once they begin a consistent schedule, they feel lighter, clearer, and more comfortable. Now let us move to what older men should avoid, because this is just as important as what they should do. The first thing to avoid is prolonged sitting. Many older men sit for hours every day. They sit while reading, watching television, eating meals, driving, and resting. Prolonged sitting compresses the pelvic floor and the prostate. It restricts blood flow. It increases heat. It increases swelling. Urologists repeatedly tell men that sitting is one of the worst habits for a congested prostate. If you sit for long periods, stand up every 30 to 40 minutes. Stretch your legs. Roll your hips gently. Change your position. These small changes keep the prostate from being compressed all day long. The second thing to avoid is dehydration. Many older men drink too little water to avoid nighttime urination. But dehydration thickens prostate fluid, making it more difficult to release. It also increases irritation and inflammation inside the gland. Proper hydration keeps the fluid thin and easier for the body to clear. Drink steadily throughout the day rather than gulping large amounts at once. The third thing to avoid is ignoring pelvic tension. Many older men clench their pelvic muscles without realizing it. Stress, worry, and aging habits cause the pelvic floor to tighten over time. A tight pelvic floor squeezes the prostate and increases congestion. Relaxation is essential. Take time each day to breathe deeply, relax your abdomen, release tension in your hips, and soften the muscles around the pelvis. This single habit can transform how your prostate feels. The fourth thing to avoid is constant fear or embarrassment around ejaculation. Many men carry beliefs from their upbringing, culture, or personal experiences that cause them to feel uncomfortable acknowledging this topic. But there is nothing inappropriate about supporting prostate drainage. It is simply a health behavior. It is as normal as stretching your back or supporting your heart. When a man removes shame from the topic, he removes hesitation. When he removes hesitation, he removes suffering. You do not need to discuss this with others. You simply need to understand that your prostate depends on this natural process to stay comfortable. The fifth thing to avoid is inflammation from poor diet. Foods that are high in sugar, heavy oils, salts, alcohol, or processed ingredients increase inflammation throughout the body. When your body is inflamed, your prostate becomes more irritated. Many older men notice that their pelvic pressure worsens after heavy meals, alcohol, or high sugar intake. Reducing inflammatory foods makes a noticeable difference. You do not need to become extremely strict. Even small improvements help the gland stay calmer and healthier. The sixth thing to avoid is ignoring early urinary symptoms. A congested prostate can press on the bladder and cause urgency, nighttime urination, or weaker flow. These symptoms are not random. They are signals. Many men assume they must accept them, but early response prevents long-term discomfort. Supporting prostate drainage often improves urinary symptoms without needing medication. But if symptoms worsen, it is important to seek medical advice. Urologists can differentiate between congestion and structural enlargement. The seventh thing to avoid is assuming you are alone. Many older men believe they are the only ones experiencing these symptoms. They believe something is wrong with them specifically. But millions of men across the United States, Canada, Europe, Australia, and beyond experience the same issues. They feel the same heaviness. They feel the same pressure. They feel the same discomfort. What separates men who suffer from men who improve is simple: knowledge and action. Now let us move to the final guidance. Your prostate will stay with you for the rest of your life. It deserves care. It deserves maintenance. It deserves your attention. You do not need to be embarrassed. You do not need to hide. You do not need to fear. You only need to understand how your body works. Your prostate is not punishing you. It is not malfunctioning. It is not failing. It is simply following its design. And your job is to support that design. Let me share one last story. In France, a 75-year-old man named Louis lived with pelvic discomfort for nearly a decade. He never spoke about it. He assumed it was normal for a man his age. When he finally saw a urologist, he learned his prostate had been congested for years. The doctor explained everything to him. Louis followed the recommendations. After a few months, the pressure was gone. He said, "I feel 10 years lighter." I only wish someone explained this sooner. This is why education matters. This is why understanding matters. This is why conversations like this matter. When men know the truth, they take control. They stop suffering in silence. They stop accepting discomfort. They start respecting their body. They start supporting their prostate. They start living with more comfort, more confidence, and more clarity. Now let us conclude with the most important message of all. Your body is always speaking. Your job is to listen. When the prostate is full, you will feel pressure. When the circulation is poor, you will feel heaviness. When the gland is irritated, you will feel discomfort. These feelings are not punishments. They are signals. They are reminders. They are requests for support. Your prostate has worked tirelessly for you since the beginning of adulthood. It has never stopped. It has never rested. It has never paused its duty. Now, in your later years, it needs your help in return. It needs your support. It needs consistency. It needs routine. It needs drainage. It needs circulation. It needs lower inflammation. It needs relaxation. It needs understanding. Take care of your prostate and it will take care of you. It will support your comfort. It will support your bladder. It will support your sleep. It will support your daily life. It will support your confidence. This is not about youth. This is about long-term health. This is about comfort. This is about respecting the natural design of the male body. This is about giving your prostate what it has needed all along: relief, attention, and regular maintenance. Now that you understand the full truth, you can move forward with clarity and confidence. You have the knowledge. You have the understanding. And now, you have the power. Your health belongs to you. Your comfort belongs to you. Your future belongs to you.